Hi, I just wanted to talk with you real brief about food sensitivities. We get questions all the time is what really is a food sensitivity? And that's a great question because it's hard to know if you have an allergy or a sensitivity, right? So an allergy, you go to your ENT doctor, they do the scratch test and they tell you, your skin raises in a bump and they tell you you have the allergy. And you can think of like a kid with a peanut allergy. Those are really hard to get over. The food sensitivity is different. Sometimes you might feel okay when you eat a food, and sometimes you notice that you react to that same food that you didn't react to yesterday. So food sensitivities are kind of hard to figure out on your own. The gold standard of figuring out your food sensitivity is to eliminate it for a certain amount of time, add that food back in, and see if you have symptoms. And that's easy to do for the big things like gluten and dairy and eggs, but it gets really hard if you're trying to figure out cinnamon and vanilla and green beans, pineapple. I've seen all of those show up on food sensitivities, and it's just impossible to take every single food and spice, eliminate it, and add it back in. So a lot of people want to do the food sensitivity testing to find out the results. But I just want to clarify that IgG food sensitivity testing isn't the end all be all. It's not black and white. There's food cross reactivities and there's other reasons why you might react to a food that doesn't show up on the IgG test, the food sensitivity test. Maybe you don't have the enzyme to break down dairy, or maybe you react to a food that releases histamine in your body. Those kinds of reactions they're not IgG antibody reactions, so they're not going to show up on this test. But most times people already know that they have reactions to certain foods. And so, you just keep those out and you use this test to find out the other foods, right? So you also have to be eating the food for it to show up on a food sensitivity test. So if you already know that gluten and dairy don't agree with you and you don't eat those, so they're not going to show up on this test because you no longer have those antibodies that are actively going to tell us that this food is causing you an issue, right? So I don't want you to start eating gluten and dairy just so that it can show up on this test, because if you already have eliminated it and you know that it's causing an issue, then there's your answer, right? Because you might add it back in and it might not show up on this test because there's other reasons why it's causing you issues. So I just want to keep that in mind. But it is a really great tool that we use to find those uncommon food sensitivities that might be reacting, because then we can eliminate them from the diet, get you feeling better, right? Reduce your symptoms because you're no longer reacting to those foods. And then the real work can begin, that we can start to look at the underlying issues of why you had that food sensitivity in the first place. Many people skip that step, right? But if you don't go there, you've eliminated the foods, whatever problem was there is still happening. So the foods that you're eating now, eventually you're going to have reactions to those too. So we have to stop the process. We have to figure out why digestion is broken. We have to support the mucosal lining of the stomach and really figure out, the underlying reasons. So just wanted you to be aware of that. And I also wanted to share that there's a list of symptoms that are common with food sensitivities that I would like to read to you. Some of those are headache, brain fog or inability to focus. You can have eczema on your skin or break out with acne. You can have fatigue, depression, anxiety, and mood swings are even associated with food sensitivities. You might have weight gain or the inability to lose weight is very common. Postnasal drip, sinus congestion, achy joints and arthritis, tight muscles or muscle pain, canker sores, racing heart, shortness of breath, tummy pain like gas and bloating, constipation, diarrhea, nausea, or even GERD. So those are some really common symptoms that people have, and it's common to food sensitivities. If you have multiple ones of those, I would suggest going ahead and getting a food sensitivity test done. The ones that we find online just don't really give us much information. So we use a company called KBMO Diagnostics, and we have researched them a lot. They're a company that have a lot, the least amount of false positives. So we really trust their results, and we get good results when we follow the protocol of eliminating the foods that show up on the test, and then doing the work to figure out why it was all happening in the first place. So hope that answers some of your questions. We're here. If you have other questions, please reach out. If you're interested in buying the food sensitivity test and getting a couple of consultations with us, you can check out our starter packages on our website, sagebrushwellness.com. Look at the services tab, and you should find all the options there. Thanks.